Kuala Lumpur, Malaysia's richest and most populous state of Selangor, which is worst hit by COVID-19, has launched its own vaccination program after a week of tension with the federal government over vaccine supply. The Selangor Vaccine Programme is the first and only independent initiative by a Malaysian state so far. It comes as Selangor, led by the federal opposition Pakatan Harapan, has been the worst hit in the pandemic for several months now. Selvax is mainly for those working in the industrial sector, which has been the largest contributor of COVID-19 cases in the state, said Selangor Menteri Besar Amirudin Shari on Wednesday when he launched Selvax. He said, 91% of our cases are due to workplace transmissions, 80% are from factories and 11% are from construction sites. The state government, through its own healthcare firm Selvax, had purchased 2.5 million doses of Sinovac vaccine, locally finished by Malaysian pharmaceutical group Pharmaniaga. Up to 2 million doses will be used to inoculate up to 1 million workers in the state's key industries, such as the manufacturing and construction sectors. Companies who enroll in the vaccination program pay an undisclosed amount to Selvax, although no charges will be levied on those who are vaccinated, including foreign workers. Another 500,000 doses will be used for a Selvax community program, which will administer free doses to 250,000 residents from the most vulnerable groups. Selvax, which will be rolled out in thousands of clinics across the state and 5 mega vaccination centers, will help Selangor inoculate 80% of its population by the end of October, said Datuk Seri Amirudin. The program will complement and run concurrently with the national immunization program by the federal government, he added. Earlier in the week, the state and federal officials briefly locked horns over the supply of vaccines to Selangor. Selangor State Executive Councillor for Health, Women and Family Empowerment, Dr. Siti Maria Mahmud, on Sunday criticized Coordinating Minister for Immunization Khairi Jamaluddin's statement that low vaccination rates in Selangor was due to a lack of capacity and not due to a lack of vaccine supply. She claimed that Selangor's vaccination centers were at the risk of running out of vaccines within days due to inadequate supply. The controversy was settled amicably by Tuesday, after Dr. Maria attended a federal immunization task force meeting and was told that the state will receive more than 4 million doses of vaccine in July. Selangor King, Sultan Sharifuddin Idris Shah, previously expressed his concern over the low supply of vaccines to Selangor despite the size of its population. The biggest contributor to Malaysia's economy, Selangor is home to 6.5 million people, about 20% of the country's population. As of Wednesday, only 4.4% of the state's targeted adult population has been fully inoculated. This was the lowest two-dose vaccination rate in Malaysia, with neighbouring Kuala Lumpur fully vaccinating 10.7% of its target population. Mr. Khairi had said that vaccination in Selangor will be ramped up significantly in the coming months in an attempt to allow the state to reopen economically by October. On Wednesday, Selangor recorded 2,836 new coronavirus cases, just below half of the nationwide tally of 6,276 new cases. This is the second time this year that Selangor has recorded this number of new daily cases, the highest so far for the state. It has a total of 245,915 COVID-19 cases so far and 1,549 deaths. Malaysia is currently under a nationwide lockdown. It will move to a second phase of a COVID-19 exit and recovery plan only if the number of daily cases fall below 4,000 and the full vaccination rate reaches 10% of the population. As of Wednesday, 6.8% of Malaysians have been fully vaccinated.